What's going on, and welcome to another video. Yo, if you're having shoulder pain that bothers you when you lift, raise your arms, reach behind your back, or even just put on your belt, then stop. Don't go anywhere and check this out. Because in this video, we're gonna share with you 5 exercises to help reduce rotator cuff tendon related pain. The rotator cuff is a crucial group of muscles in the shoulder that help the stronger and larger muscles perform their job effectively. The problem is they're small and they don't make you look ripped, so we often overlook them. Whenever we lift too heavy or lift too much or fuss around with awkward positions, then we overload, stress, use, and abuse this group of muscles, and the tendon is usually the first part of that muscle to speak up. In order to restore balance, we need to strengthen this group of muscles in a stepwise fashion, making them more effective in their supporting role and reducing the strain. So let's talk about some excellent ways to keep the rotator cuff healthy, reduce pain, and improve performance. The main goals are to load the rotator cuff in different positions and strengthen the lower part of the trapezius. It helps to control the shoulder too. For each of these, we want you to stick to higher repetitions of 15 to 20 per set and try for 3 sets. If you can't get that many, it just gives you something to work towards. So let's start with the most basic of the basic with a twist. Side lying, shoulder external rotation. First, lay on your unaffected side with your elbow bent and resting on your side. You can place a pillow or a towel roll between your arm and your body if this position is uncomfortable. Start with your hand on your stomach. Lift your hand up toward the ceiling by rotating your shoulder while keeping your elbow resting on your side, and then return to the start position. You should feel this working in the shoulder blade or maybe the side of your arm. Your mid-back might be working too. Next, let's talk about standing cools. This is one that looks way easier than it really is. Place a band around your wrists and bend your elbows, keeping them by your sides. With tension on the band, lift your arms up to about shoulder height. Keep tension on the band throughout the motion and don't let your elbows flare out. You want to try to keep your elbows closer together than your hands. And you should feel this exercise in the back of your shoulders. Now, we're going to somewhat combine these two and do standing external rotation to elevation. Start with the band anchored to something. You can use a cable column as well. Start with your hand on your stomach with tension on the band. Next, keeping your elbow touching your side, rotate your hand away from your body until your hand is straight out in front of your elbow. Next, raise your shoulder forward until your elbow is straight. Then return to the starting position. You should feel like muscles are working in the back of your shoulder. Next, we're going to introduce you to shoulder external rotation at shoulder height, or 90-90 ER. Stand facing the band or cable column with your arm out at shoulder height and your elbow bent so that your palm is facing the ground. Keeping your elbow stationary, rotate your shoulder so that your palms are facing forward. Now return to the starting position with control. Make sure that your elbow doesn't fall down below the level of your shoulder. If this is too difficult, you can hold at the top position instead of moving it in and out of the motion, and hold for about 5 seconds, and then again return to neutral. Next up is the cable cross. Start with the cable or bands up at eye level. Cross your arms and hold onto the resistance with your palms facing back towards you. Now uncross your arms by pulling them down and out, leading with your shoulder blades. Keep your elbows straight throughout the motion and be sure to engage through the shoulder blades by pulling them down and back as you bring your arms down. At the end of the pull, your arms should be at your side, hands facing forward, and your elbows relatively straight. This should be felt along the bottom of your shoulder blades and not in your triceps or the back of the shoulders themselves. So there you have it, 5 exercises that can help you maximize shoulder function, reduce pain, and help you return to, well, whatever you want. If these exercises were helpful but didn't quite get you to 100%, we have a complete online rehab program dedicated to helping relieve rotator cuff related pain in your own time. This program reflects the education and exercise progressions of a physical therapy plan of care and is delivered in the same fast-paced cinematic style as our YouTube videos. We take you step by step through assessment of the problem, the 3 phases of recovery, and objective ways to track your progression. Within each of those phases, we're going to guide you through some testing, exercises, and expectations. We'll also give you a clear explanation of how your body should and shouldn't respond to load to help empower your decision making when it comes to progressing, regressing, or seeking help. And then we'll give you a select number of exercises to focus on within each phase, as well as a training schedule to follow. This program literally includes everything you need to know to stop just dealing with shoulder pain and start living, moving, and performing without limits. So for real, stop playing with it. There's no time like right now. We've dropped a link in the description so that you can take it to the next level. Now let's go get it.